Good morning, students. Good morning, students. My name is Professor Carlos Hernandez. I'm being invited here to talk about meningitis, to talk about infections. I know you guys are going through the first class of about infections, so I'm here just to help you out and let you know more knowledge about what is especially meningitis. Because we're going to talk meningitis, the reason I'm talking about this subject is because I went through a personal uh, story with this. I have a personal story with this with my son. My son, when he was newborn, he was diagnosed with meningitis, and we're going to talk about that a little bit because that actually left a big impact on me personally back in those days. So I know some of you guys are parents, and some of you guys are probably will have be father or mother someday. So I think you have to be aware of this and know what to expect, know what to see, the symptoms, and when to go to see the doctor, because this actually is a life-threatening disease that is kind of sneaky, and we don't know exactly the symptoms until we go see the doctor. So what is meningitis especially? Meningitis is a serious life-threatening disease which involves inflammation of the membranes around the brain and also in the spinal cord. They call them meninges. What type of infections we have, like the bacterial, fungal, and also the viral infection. All of this cause inflammation of the meninges. One of the one of them one of the bacteria that causes this is the Neisseria meningitis. Those are the meningococcal meningitis, and the other one is the streptococcal pneumonia, which is a pneumococcal meningitis. As you see in the slides, the location of the meningitis actually is around the membrane that surrounds the central nervous system. We have the nervous system that surrounds the brain. You go into with the spinal cord all the way down to the tailbone of the coccyx. And now here in the head, we have the skull, then we have like the dura mater, then we have the arytenoid mater, and then we have the pia mater. These are the tiny little space between the skull and the brain, and that's where goes the meninges, and that's where the bacteria or the virus actually attack. They attack this area, this bacteria, and make us all sick. We have against another picture here about the bacterial meningitis, but they can make the Haemophilus influenza, the meningococcus mumps group AAV, and the streptococcus listeria. Here we have another graphic on how the bacteria can come in through our nose, and it stays here inside in our respiratory air cavity, and then can go through. It's dormed there. It can sometimes, in the weird cases, can go through our membranes right here, and go and get into our spinal cord. Once in our spinal cord kind of grounds and invades where is our the meninges around the brain, around the skull, on the brain, and get us infected, get us sick. What is a viral meningitis? Viral meningitis is actually less dangerous than bacterial meningitis. Viral meningitis doesn't require sometimes any type of antibiotics. Well, it doesn't require antibiotics, but it causes by the enterovirus. Enterovirus also can cause some abdominal pain or diseases. Just like any other common enterovirus, like the Coxsackie or the echovirus. They can cause the influenza, can cause the herpes, can cause the hand, mouth, and foot disease, mumps, and measles, to name some. We have also here another picture of like the baby, and was a normal brain, and the right one is like a brain infected already with meningitis, which can be fatal. In the next picture here, We have the age groups and the causes of meningitis. Sorry, I'm a little bit under the weather still. In newborns, in the case of my son Dominic, we have we have the group B, the Streptococcus, and the X and the Escherichia, the Escherichia coli, and the Listeria monocytogenes. Cytogens. In infants and children, we have the Streptococcus pneumoniae, and the Neisseria meningitis, and the and the Homophilus influenza type B. In adolescents and young adults, we have again the Neisseria meningitis, the Streptococcus pneumoniae, the Streptococcus. Also in adults, the Streptococcus pneumoniae, the Neisseria meningitis, and the Listeria monocytogenes. Transmission of meningitis. Meningitis, as it can be contagious by some bacteria, can spread through the exchange of or respiratory by the exchange, the saliva, in this case by kissing, of respiratory and throat secretions like saliva and mucus. In the case of my son, actually, I think it was, I don't know, maybe it was like in the environment, something in the hospital when he was born, that he got the meningitis. Fortunately, most of the bacteria that can cause meningitis are not contagious as a virus that can cause a common cold or flu, which is good because otherwise we all getting around this time meningitis too. Do not spread by contact or simple breathing in the air, as a person with meningitis has been. Other meningitis causes the bacteria. I'm not I'm not spread person to person, but can cause diseases. But can insert the risk factors such as weak immune system. So if the person has a very weak immune system, can get the meningitis. The symptoms of meningitis here we have, especially in a baby. I'll put a picture of a baby because that's what happened to me. So that's why I'm using this. Here we have like in the tense or like here in the bulging on the soft spot in the baby is actually in the fontanelle. It can be like a little bit inflamed. I think that was a little bit of the case of my son. That he was a little bit inflamed with the fontanelle. Also weakness. He cried a lot, especially when we picked him up. For no reason, he just started crying. His fever spiked a little bit. I think he was 103.2, and he was just very sick. It was a viral meningitis. Let's talk about viral meningitis. Has incubation of 3 to 6 days, and it lasts kind of like 7 to 10 days. It's less stronger than bacterial meningitis. Affects the children under the 5 years old. Most viral meningitis due to enteroviruses, as I mentioned before, that can cause intestinal illness also. Meningitis is diagnosed by lab and the patient by patients with a spinal fluid. Now, spinal fluid, we have a picture here in a baby actually, how they do the spinal fluid, how they take the spinal fluid by spinal puncture. It's called lumbar puncture also because of the lumbar section of the spine where they remove some of the fluid to check. Now the fluid, it can be like here we have a sample, so they can be like clear. If the fluid is clear by a simple eye, by the naked eye, actually it looks good. If it's a little murky or yellow, looks infected. But even though if it's still clear, it needs to go to the lab to be checked out. Now we have the complications, and when my son especially, I put a picture of some teeth here because he gets some loss of the dental enamel and still have to deal with it. So he goes to the doctor every twice a year to the dentist to be checked to enamel, and he has to be extra care with his teeth because the bacterial meningitis at the time actually attack a little bit to his teeth. And we have another complications of brain damage. Also, it can be hearing loss, hydrocephalus, and seizures if it doesn't take care. And sometimes people can lose the extremities because of meningitis. Diagnosis: how we can get a diagnosis by lumbar puncture, blood culture, CT scans, X-rays, and also the gram stain and the culture of the central spinal fluid. Here's a picture of the meningitis in the brain. we have the yellowish part, the cerebral cortex, and also we have where the arrow is, we have like the where the meningitis is located in the brain or has infected. Meningitis stage, well, we have meningitis started confusing the difficulty of the symptoms because it's kind of hard to diagnose just like that. It has some fever, some vomiting, some headaches, some rash, and also babies get lethargic, sleepy, and they have high fever like my son did. Meningitis, the research actually way back in the days, Hippocrates described meningitis in his work. Sir Robert Wiley and reported in 1768 the tuberculous meningitis. The first meningitis outbreak was recorded in Geneva in 1805, and the first outbreak in America was reported by Eliza North, which lived from 1971 to 1843 in Massachusetts. Now, the symptoms that were described by the Russian in 1884, Dr. Vladimir Kernik, and the first lumbar puncture was done in 1891 by Hendrik Kinch. In 1934, Dr. Armstrong and Lilly isolated the virus from the cerebrospinal fluid in patients, which actually was one of the best things to do. In 1906, researchers noted that horses could use to be create antibodies against meningococcal bacteria. In 1944, penicillin was effective against meningitis. Penicillin, I think, is one of the best discoveries in our world. And antibiotic therapy began in the 20th century by Chester Kiefer in America using penicillin. In 2002, the treatment of steroids could improve prognosis to the bacterial meningitis. Now, in 2000, the Center for Disease Control and Prevention, the CDC, recommended their colleagues and universities to all the students that is the meningococcal disease and the ability of the vaccine, because these attack sometimes more the young people. In 2007, the Advisory Committee of Immunization Practices, the ACIP, recommended routine vaccinations for preteens against meningococcal disease at the age of 12 and 11. And here we have a picture of my son Dominic. The left is in Ecuador, we went to the City Vikings. So he is actually doing better. He is actually doing great, and I'm very blessed to have him alive. And so, if you have any questions, please.